Dr. Kaylin Rigby from Highland Family Medicine is with us. Doctor, thanks for a few minutes. Great to see you.
Oh, yes. Good morning. Thank you so much for having me.
So we are talking about back to school as we ramp up a new school year here. And I want to begin by talking about the rise in COVID cases among children. We have documented it over the summer months. And the question for parents, should they be concerned sending their children back to the classroom this fall?
Yeah, that's definitely a valid concern because since the beginning of the summer, we've seen almost a fourfold increase in the number of child COVID cases across the country, reaching levels that are similar to the winter surge that we had. And there's also been a big rise in RSV infections too. We think this may be related to the loosening of mask restrictions. So definitely valid that parents are worried, but I think it can be done safely as long as kids and parents remember to take the right precautions like wearing their masks, good hand hygiene, social distancing.
How do vaccines play into this conversation, Doctor?
Yeah, vaccines are crucial because kids going back, less than 12 years of age can't themselves get vaccinated. So then us as a community need to protect them by getting the vaccine and preventing transmission. And I know there's a lot of concern. The Delta variant, there will be more breakthrough cases because it's so contagious. But getting the vaccine can really help reduce the transmission and severity of disease. And I've been taking care of patients in the hospital who are really sick with COVID. And that is a lot more scary, being that sick in the hospital, than getting the vaccine or getting the side effects associated with the vaccine. And patients in the hospital who are that sick actually will ask if they can get vaccine while in the hospital or like as soon as possible after they leave the hospital. I think it just shows, it changes your perspective when you're that sick or when you're taking care of people that are that sick, that all that suffering could have been prevented if they got the COVID vaccine.
Having said that, you're well aware that many are still hesitant to get the vaccine. What is your messaging for folks who fall into that category?
Yeah, so a lot of my patients, who come in who are hesitant still about getting the vaccine, and it's sometimes heartbreaking too. Because, people and my patients follow my advice in so many aspects of their lives. And as their physician, I really care about them, and I really feel a responsibility for their health and well-being. So I want people to get vaccinated, to essentially take the life jacket that they've been given, and so that I don't have to see them in the hospital or ICU.
Such an important conversation as we head back to school this fall. Dr. Rigby, thank you so much.
You're welcome. Thanks again for having me.
For sure. If you missed any of this conversation, we will be sharing it online as we do. You'll find it posted at rochesterfirst.com.